right, so unless I hear otherwise from Diana or Roz, I will go ahead
Yes.
and get us started. Good afternoon, everyone. Today is July 7th, 2020, and we have convened the Board of Health for the New York City Department of Health and Mental Hygiene. It is 4:01 p.m. and I am calling this meeting to order. I want to welcome everyone to our third online Board of Health meeting. And I want to begin by calling roll call. I'm going to call out your name, and when I do, if you could please respond. Gail Neowith.
Present.
Dr. Joel Foreman.
Here.
Karen Redlener.
I'm here.
Dr. Lynn Richardson.
I'm here.
Pamela Breyer.
I'm here.
Dr. Mitch Katz. Rosa Gill.
I'm here.
Dr. Sixto Caro. Dr. Susan Klitzman.
Here.
Terrific. Thank you very much. Before we get started with today's agenda, I want to just ask two things. One is, if you're not speaking, please keep yourself on mute. And if after our presentation, you want to ask a question, please use the raise your hand icon on the screen. And no worries if you can't find it, just raise your hand on the actual screen and I will try to call on you as well. The first thing I want to do is starting off with approval of the minutes from April 28th, 2020 meeting. Are there any corrections to the minutes from that meeting?
Commissioner, we got some changes that we're making, some minor changes, and those will be made.
Fantastic. Thank you very much. I was going to start looking for Dr. Foreman on the screen.
Dr. Foreman has been in touch. Dr. Foreman has been in touch.
Terrific. Well, thank you very much. So with that being said, the corrections having been sent, I guess, Roz, in order for the members to vote in the affirmative, do they need to know what the amendments are that are being proposed?
They're very quick.
I'm sorry, go ahead, Dr. Foreman.
I can tell you them very quickly.
Yes.
For those who want to know, page 14, line 3, there was a sentence that ended in, we all know that it's just the tip of the iceberg of people who have been tested, and the word should have been infected in that setting. And on page 34, line 17, there was a discussion about, I think it was nursing homes, and they used the word students, and it should have been patients. That's it.
And yeah, and there was one additional one from me, which was on page 43. There was just a typo with 2 words missing. It should have read not a permanent change instead of permanent change, and that was it.
Great. Thank you very much. So if there are no further corrections, I will take a motion to approve.
So moved.
Second.
Terrific. All in favor?
Aye.
Aye.
Any opposed? Okay. The minutes are approved as amended for April 28th, 2020. So today's board meeting will be voting on COVID-19 mitigation, rescind the child care closure. Today's presenter is going to be Deputy Commissioner Corinne Schiff. She's the Deputy Commissioner for the Division of Environmental Health. I am going to now turn it over to Corinne for the presentation. Thank you, Corinne.
Thank you, Commissioner. Good afternoon, everybody. So we are here to propose that the board rescind the order issued in April that temporarily closed childcare. As the board remembers, it was in early April that you ordered childcare programs operating under Health Code Article 43 and 47 to close temporarily as of April 6th as a COVID-19 mitigation measure. And there was an exception for emergency programs for children of essential workers. Next slide. Background and why we are coming to you today with this recommendation is, as the board is, I'm sure, aware, transmission of COVID-19 has slowed in New York City, and we continue to see a decline in case counts. And as New York City reopens, more parents and guardians are returning to work outside the home, and they rely on childcare. And they may turn to informal care if regulated programs remain closed. Next, the city's contact tracing program is in place. Cases are being contacted, close contacts are identified. Childcare programs will be notified, and children and adults in a classroom will all be considered close contacts if there is a case of a child or an adult in that classroom, and they will be directed to stay home for 14 days. Up next, New York State has now issued requirements for COVID-19 risk reduction measures. And we wanted also for the board to be aware that New York State has made funding available to programs to help them make the changes that are required, and they need to reopen by the 29th of July in order to be eligible for that. I wanted to walk through some of the New York State COVID-19 mitigation requirements. It is New York State that is issuing the requirements for childcare. The department has emailed child care programs twice with the information about the New York State mandates, with a recommendation that they review those and begin their preparations so that they would be able to reopen. In addition to the requirements that New York State has issued, the department has created multiple resources that are online and that we referred child care providers to. These are tools to help them, to support them in compliance. So some of the important mitigation measures that New York State is requiring are that group size be no greater than 15 children, that programs maintain stable groups without mixing or rotating children or staff, adults need to wear face coverings, programs need to do routine, frequent cleaning and sanitizing, they need to train their staff, and they need to do daily health screenings for both staff and children. And importantly, New York State is requiring that programs create a safety plan. And this is a really great measure that means that childcare programs are required to review all of the mandates and think through how they're going to apply them in their programs. Next slide, please. Diana, can you advance the slide? Thanks. So if the board approves this proposal, then I wanted to let you know about how our immediate implementation steps. We will be notifying childcare programs that they can open. We will once again point them to the New York State requirements, and again to the tools that we have developed for them, an FAQ, a checklist, some model tools such as to log cleaning schedules and signage. We'll be offering webinars to walk them through what is required and take questions. We're going to be able to provide ongoing individualized technical assistance for programs that want that. And we're also developing information for parents so that parents know how childcare will look different this year and what is expected of childcare programs and of families. So to state the proposal, we're proposing that the board rescind its April order, which, as you recall, was modified, that ordered childcare programs to close. This would mean that childcare programs operating under Article 43 and 47 can reopen, and we are proposing an effective date of July 13th. Of course, that would be an option. This wouldn't be a mandate to open. Childcare programs would be able to open July 13th if they are ready. And with that, I can take questions.
Corinne, why don't we begin with the questions that Gail submitted, and we can just run through those. Gail, is that okay?
That would be fantastic. Thanks.
Great.
Sure. Thank you for sending those questions. Do you want me to should I just read the question and then I can just read the question and answer it? Okay. There was a question about what the city's experience has been with COVID illness or outbreaks at the RECs, which are the DOE operated emergency childcare programs. We and the DOE are not aware of any outbreaks in the RECs. There were some cases, basically in adults, people stayed home, and that was it. There was a question about how we would do, how we will handle reporting of cases in childcare. So I can walk through a little more detail about that. So as part of New York City's test and trace for cases, or if case is a child, the parent or guardian of the child will be contacted and asked about close contacts, and a close contact will include children or adults in that child's classroom. There's also a long-standing requirement in the health code that parents notify childcare programs when there is a communicable disease, and also for the childcare program to notify the department. So this is a protocol that programs are very much familiar with and that we will be walking them through in our training as a reminder. So when we get these notifications, that'll trigger follow-up with the childcare program to identify those close contacts, and then children and adults in the particular classroom, as I noted, are considered close contacts, and they will be notified to stay home for 14 days and to seek testing. And we will be providing this information and training to programs and also to parents. The next question was whether there are differentiated public health practice requirements for childcare for infants and toddlers, preschool, and school-age children. So as I noted, it is New York State that is issuing the requirements, and the public health principles that are reflected in the New York State mandates apply regardless of the child's age. There are some small differences. For example, young children are not required to wear face coverings when they're in the classroom. They are required if they're going on a trip, but when they're in the classroom, they don't have to wear face coverings. And then things like teachers are encouraged to wear smocks or other kinds of clothes that are easily changed. And that might be something that's more relevant when caring for an infant, where you're doing diaper changing and a lot of feeding, where you would want to, as a sort of an infection control measure, be able to just switch your clothes, and that might be less relevant for older children. But for the most part, the public health practices are applicable for all children in childcare. The next question was about whether the city is making PPE available to childcare centers, and I think that that's referring to face coverings. So Small Business Services is supporting small businesses, including childcare programs, by providing access to free and low-cost supplies, including face coverings, and also information about loans. And as I noted, New York State has a grant opportunity open for childcare programs to support and help them offset some of the costs. And we have alerted childcare programs to these resources. And then I think the last question was whether there will be online training and website guidance. And I noted that we will be doing webinars, and we have created multiple tools that are available on our website. I know there was one more question, which was whether the New York State requirements are for childcare centers and camps. And yes, the COVID mitigation mandates that I talked through briefly are applicable to both childcare programs and to camps. And I hope, if that did not answer the questions, let me know. But I think
thank you.
hope I did that.
Great, thanks.
Terrific. Okay, so Gail, thank you for those comprehensive questions. I think it covered a lot and gave us the opportunity to address some issues that I'm sure other members probably had questions about as well. Any other members have questions? Susan, and then I'll take Joel.
Yes. Thank you, Corinne. I was just wondering what sorts of concerns you've been hearing from daycare center staff and parents, if you could share that with us.
We have been hearing from childcare programs. You know, we've heard from them a lot, asking when they will be able to reopen. They have parents who are going back to work and are seeking their services. And you know, we have put together our training in response to questions where people just really want to understand what is required to comply with New York State and to provide the best risk reduction method that they can for their family. So I think they're learning this. We will be reviewing the protocols with them, but I think the main question that I think we have gotten from childcare is that they have families who need their services, and when will they be able to reopen?
Right.
Joel, please, and then I'll take Pam.
Thanks so much, and thanks, Gail, for those I did have some of those questions. I can cross them off now. I just wanted to circle back to one of the New York State recommendations, and that's face coverings, and Karen's question about whether there was any difference by age of the children, particularly if this is going through camp age. So I just wanted to review which age children that would be in these settings, and would even the older children who are going to be in groups up to 15 and not socially distanced not be asked or required to wear face coverings.
Yes. So the way that New York State has framed this question about face coverings is, of course, for children under 2, face coverings are there are no face coverings for children under 2, and they have said, let me see if I can find exactly the language, because the New York State mandates are for childcare and for camps. Camps go obviously for much older children, and so what New York State has said is that face coverings are for, I can read it exactly to you, young children / campers. Those not yet in kindergarten do not need to wear face coverings when they're in childcare or camp program facilities or areas. And older children are encouraged but not required to wear face coverings as feasible. And then making the point that for children under 2, they don't wear face coverings. And of course, anyone who's unable to medically tolerate them would not wear them. So that's how New York State has broken it down in terms of age, given that they've put out one set of requirements that are for children in childcare and also for older children who are in camps.
So they broke it at about age 5. Correct?
Yes, exactly, at about age 5. And you recall that Article 43 applies to children aged 3 to 5 and 47 children under 6.
And I'll just add to what Corinne laid out, that they also acknowledge the need to take developmental milestones into consideration, because even though certain children may be of a particular age, developmentally, they may not be able to tolerate the face covering. And, the question is, does it create a greater risk to have them wear face coverings as opposed to the benefit? Did you have another question, Dr. Foreman?
Oh, sorry, I did not. Thank you.
Okay, great. Pam, did I hear you earlier that you wanted to ask a question?
Yes, you did.
I think you're still on mute.
You're on mute, Pam. I'm unmuted now, right? Right.
Thank you.
So, one of my questions was Joel, so that was answered. And then the other question, I'm just curious. During this period, have you been in touch with the people in these centers? I mean, they're not going to be surprised at our action today, or are they anticipating it? Are they starting to get ready more? What can you tell us a little about that?
Yes. So we have been, throughout the public health emergency, we have been receiving questions from individual childcare programs, from associations of childcare programs, and we have been responding to those And then in preparation for what we knew we would ultimately do at some point, come back to you, we have been emailing with childcare programs, sending them the New York State requirements, sending them FAQs, a checklist, sample tools that they can use, and to let them know that this is what will be required and that they should begin preparations. There are changes that they need to make, and we wanted them to be prepared. So we sent the first email to them with the New York State requirements on June 19th. We sent another one late last week, and there's been other correspondence too, letting them know about SBS that I mentioned, the resources available to them. So we have been in touch with them, and in particular about these New York State requirements, to say, please review them so that you will be ready.
Right. Thank you.
Lynn and then Karen.
Thank you. I raised my hand electronically, but that didn't seem to get your attention. So I started raising my actual hand.
Thank you.
So if you could just review for us, Corinne, the order applies to all childcare facilities that are regulated by the department, both those that are school-based and those that are freestanding. Is that correct?
Yes, so the order that the board issued to temporarily close childcare applied to Article 43 programs. Those are programs that serve children aged 3 to 5 in school-based programs, so they are part of an ongoing school program, and also to childcare centers, which are regulated under Article 47 and which are freestanding programs serving children under age 6.
Now, are there any special challenges for the school-based programs, given, of course, that the schools are not yet open? How will that work?
So I think that will be for many programs, that's going to be an important operational question, and I think will differ depending on their host school.
Okay. Thank you.
Karen.
Thank you. You know, it's a very interesting start to reopening childcare / school facilities. And I'm interested in the alignment between the New York State guidelines and the New York City guidelines, because I know that, you know, we need to accommodate, and then we might have other things that we want to add to what New York State says. So would you basically say that we are adapting all the New York State requirements and implementing them as they recommend? Are there additional things or complementary policies or protocols that the New York City is adding to the state, or what is your assessment of that?
Yeah, so with the childcare requirements that New York State has issued, and really with all of the reopening documents that New York State has issued for the various industries in New York, they have applied the same public health principles that we would have. They're very comprehensive, and we agree with the requirements that New York State has issued. And so what we have really seen is our role. Given that New York State has put out a comprehensive set of rules, our role is really to support programs and other businesses to help them be able to implement them. So that's why we've created FAQs and checklists and logs and a model screening tool, so that businesses, we've sort of given some examples for how you can implement that. This is really in the details. Everyone has to dig into the details of their own operation, and so we're here to help childcare programs be able to take the New York State requirements and implement them in their settings.
That's great, and obviously that makes so much sense. I also am interested in the contact tracing protocols. I'm in another group that is talking about the reopening of all the schools in the fall. And there's a lot of question and concern about the protocol and how quickly it can be implemented. Are there point people with the the Department of Health, HHC, the schools, the childcare, the parents? You know, And I think there was even some question about, some people might have in the school might have symptoms, but they haven't tested yet. How quickly can they get the results? When does that, are there guidelines that you all have already developed for that? Because I know that it is, it's a big question on the DOE side for this coming school reopening.
Yes, so I can't speak to schools. We are working on this for childcare. Colleagues I know are working closely with DOE for schools, but for childcare, we do have a protocol, and we will be sending that to childcare programs, posting that on our website, and letting parents know what that protocol is as well. We want everyone to understand what is going to happen, what the expectations are going to be, and there are point people. And because this is actually is already a protocol that the health code covers, childcare programs are quite familiar with the reporting process. The city now has test and trace. So it's almost I'm thinking of it almost as a belts and suspenders approach, because we have our existing protocols, which is that childcare programs notify their particular everyone has a contact person in our Bureau of Childcare. They notify that person has a person to notify in our central office, who then communicates with the disease detective bureau in the department. And so that protocol is longstanding, and childcare programs are familiar with it. And as I said, we will be sort of retraining them, reminding them how it will work. And then also with test and trace, people who get a positive COVID test will be contacted by test and trace. That's another way, an additional way that close contacts will be identified. The letters that will go home to families have already been developed. We will be publishing those on the website. We want everyone to know what will happen, and the directions will be pretty straightforward. We need you to stay home for 14 days. We are recommending that you get testing, speak with your healthcare provider if you have concerns.
Thank you. And the people who need to stay home are the children and staff in that classroom where there is a positive.
Yes, we will. The assumption will be that everyone in that classroom is a close contact. There could be, depending on how the program operates, other close contacts, but we will certainly, the assumption will be everyone in that classroom is a close contact. And this is, as we train programs, we will also be explaining this as part of why group stability will be important, because that's how you're also going to be limiting your close contact. So we really want people to understand how this works and what's going to happen, and that we're really all in this together to continue to slow the spread of COVID-19.
Right. Thank you for that. It makes so much sense. The other thing, I just want a follow-up question, I believe, from Gail on the experience of the rec centers and now the experience of the childcare centers. I think it could be really helpful to communicate in some formal way to the public that children have been in these congregate settings for a number of months, and there have been few outbreaks. They've been handled, within a cohort or whatever in terms of the follow-up. And then whatever the experience is now with childcare as we go through this summer, I've just heard so many concerns about, either from families or teachers or others on the school side about, outbreaks in schools and how it will be handled and how, what the risks are to children. But I think it's good if we have this 6 months worth of experience of children going back into some sort of congregate facilities, and us being able, the system being able to, identify quickly whatever positive cases there are, and then handle it, within a quick response time, and not having a whole school have to close down or fear of an outbreak type of thing.
So Karen, I would just sort of clarify one thing that you said. We actually don't have any documentation of any outbreaks. We know that there have been sporadic cases and there hasn't been any ongoing transmission. Okay. But I think your point is well taken, that the fact that there haven't been any clusters traced to these existing centers that have been open, speaks to the importance of continuing with the preventive measures that have been put in place with regards to the face coverings, the regularized cleaning, the preventive measures, and obviously people staying home if they're ill. So that's a point very well taken.
Thank you. I'm just wondering if some of the public health messages that are coming from the department and this city hall, it's so important that we keep these public health measures in place, these social distancing and various protections in place for the reopening of school, in order to ensure or, have a greater ability of schools to be opened in the fall. One of the, it's sort of like connecting the, maintaining our protocols of public health measures now and going forward, so we continue to be in phase 3 or phase 4, so that schools can open safely, and people can start to go back to work in a more predictable way. It feels like it could be used as a motivator. Like, as you said, we're all in this together, and that is really, I think the opening of the schools is affecting so many people in their planning of their economic lives as well as personal lives. So anyway, I just think it's very motivating.
Yeah,
Just a
no,
suggestion
absolutely.
to the communicators.
Absolutely. Absolutely. Thank you for that. Any other questions before? Yes, Sixto.
I am mute. Hi. I just want to take home the idea that how detailed will be the requirement for safety plan, protocol, guidelines, requirement, etc., will be sent to each child care center, each by webinar, by email. How detailed will be? That's the only question I have that I asking myself.
So we will be sending the information out to all of the child care centers, inviting all of them to participate in the webinars and directing all of them to create the safety plan. It's something that they create and they keep it on site, and it's something that we will look for when we conduct our inspections.
Thank you.
Any other questions before we call our vote? Okay, so hearing no further questions and seeing no hands raised on the screen, I will entertain a motion for the motion as stated, which is rescinding the April 3rd order and allowing Article 43 and Article 47s to reopen.
Move to
Earlier than the 13th.
Second.
So, I'm sorry, so Commissioner, the April 3rd and April 5th, both orders.
Both orders. Sorry, thank you.
Move
So
to
I heard a
rescind both
motion
orders.
and a second.
Yeah.
Excellent. All in favor?
Aye.
Aye.
Any opposed? Okay, the motion carries, and I want to thank you all for your continued flexibility in calling emergency meetings of the board, and also for your ongoing participation and contribution to ensuring that our forward planning, whether it's related to schools, hospitals, social service providers, educational institutions, all in your original domains, all of that goes as smoothly as possible. And as Corinne says, as Karen reiterated, and as we are all committed to, we're all in this together. So I want to thank you all for your ongoing work, and I look forward to the day that we can have resumed in-person meetings. But until then, I wish you all well, and until next time that we see each other on Zoom, be well. Thank you.
Thank you.
Thank you.
Thank you.
Bye.
Thanks.
Bye, everyone.
Yeah, thank you. Joel. Oy. No, don't.